sir, welcome.
Very good morning to you.
Thank you, sir. Welcome to Eklavya Foundation for Mental Health. Sir, we are mental health activists and we are doing this community work in the mental health sector. So we would like to talk about it and we want some guidelines about it. So can you just tell us what is the exact role of community? How community can participate in mental health issue or this mental health sector?
Thank you very much for inviting me. This is a subject which is very close to my heart. And we have been doing involvement of the community in mental health for the last 40 years. And particularly we always involve family members in the treatment program. And family being a part of community, smallest part of community, smallest unit of community, unless they realize what is the nature of the psychiatric problem or mental disorder their patient is suffering from, they will not be able to help them. So we are involved in community mental health work for the past 40 years or so. Out of 50 years of practice where we have been doing. So, what is the role of community mental health, or how community can help in mentally ill patient? So, say India's current population is 1.4 billion or 140 crore, and out of these 15 crores are the patients who have active and serious mental illness. And there may be another 15 to 20 crores who have mild mental illness or mental health issue. But there are only 7,000 to 9,000 mental health workers.
That is very less, sir.
That is very true. That includes mental psychiatrists, psychiatric social workers and clinical psychologists. So naturally, this minuscule number of mental health workers cannot look after 30 to 35 crore patients. So that is why the main responsibility of looking after mental health needs of this population falls on community and on the family. Many times family patients are unable to reach mental health professionals. In that case, you have to depend upon family and community to develop, to help them.
But sir, sometimes how generally there is a notion that if you are not professional, you cannot help in this sector. So this is generally, people have notion about it that I don't know anything about it, something like that. So this is how community thinks basically.
No, for that purpose, what is primary requirement is how compassionate you are. If you have compassion in you, you will always be able to help others in the community. And for that purpose, you may have to develop mental health literacy. You will have to read little bit about mental disorders and mental health. And then you will have to equip yourself to do mental health work in the community.
Sir, how you used to do in your hospital, how you used to ask your participants or how you used to get support from community? Means you would like to hear about that.
Yes, we always used to have meetings, group meetings for the family members. And family members being the part of community, they used to spread this message of mental health literacy in the community. Similarly, we used to make them realize they are the primary ambassadors of mental health literacy to the community as well as to their patients. They have to develop understanding into nature of mental health as well as mental disorders and help the patient to understand his or her mental health disorder or disorders and make them understand to develop how important it is to develop mental health. So That is how, and sometimes we used to go for lectures outside to give in the community, in colleges, in schools. So that is the way we used to try to spread message of mental health literacy. Important is whole community should be aware about mental health and mental disorders. For that, mental health should be a part of the curriculum right from nurseries to the university levels. So it should be made a part of education right from the childhood till adulthood. So that will help people in general population to develop mental health literacy.
Well, yes, sir. What you are saying is really correct because these are the crucial years where teachers observe students. So if teachers have or if it is in curriculum, they can spot these things in early ages, specifically when they are into adolescent ages. So we observe that kids are more in the school than home. So teachers should be better equipped to do that also, if they have that mental health literacy or some information about mental.
Yes, that is very important. Somebody has written a book and it is called Whatever I Knew, I Learned in Kindergarten. And that is a very important, right from childhood, what we learn, what value system is inculcated in us will last us a lifelong. So it is very important to catch children in younger age group, in preschool age as well as during primary school, because those are the things which last lifelong. In kindergarten it is taught that you should not hurt others, you should not beat others, you should say sorry when you hurt somebody. Don't mess up your room. Keep the things where they belong. If you find something on this thing, keep it in proper place. Wash your hands before you eat. All these things are taught in the initial years, and they really last long throughout the life. So, if the mental health is made part of that curriculum, this will help to develop mentally literate community.